Good afternoon, my people. Let me start by thanking you guys for the support you are giving to this channel. I thank you for the subscriptions, for the likes, the comments, and those who are sharing. Feel appreciated, because if it were not for you, this channel could not have been where it is at the moment. We are still discussing about the available methods of family planning or birth control methods. We discussed the first one, the second one, the third one, and now we are getting to the fourth one, which is the diaphragm method. What is diaphragm? It's a form of reusable, that means you can use and use it again. It's a form of reusable prescription. You can use and use it again, and it's a prescription birth control. So you can't just go to the chemist and just buy it. You have to have a prescription. So it's a form of reusable prescription birth control, which is a soft silicone disc. Soft silicone disc. You saturate or fill it with spermicide, then insert it into the vagina, where it acts like the cervix bodyguard. It acts like the cervix bodyguard, keeping sperm out of the cervix to avoid entry into the uterus. Let me repeat this. You saturate or fill it with spermicide, then insert it into the vagina or the female reproductive organ, where it acts like the cervix bodyguard by keeping the sperms out. Diaphragm is 96% effective. That is, if correctly used. It's non-hormonal and latex-free. It's non-hormonal and latex-free, and a good option to somebody allergic to latex. So those who are always allergic to this latex, like the condoms, this is a better option for you, because it's non-hormonal, it has no hormone, and latex-free. So if you are allergic to hormonal contraceptives and also allergic to latex, this is a better option for you, because it's an non-hormonal and latex free. Diaphragm, this is a point to note. Diaphragm can get knocked out of place with aggressive thrusting, and also effective for those prone to UTIs. So if you have a rough partner with aggression or aggressive thrashing, it will dislocate or it will knock out the diaphragm from the cervix, and when it dislodges, sperms can penetrate to the uterus and make you pregnant. Another advantage of this is that it's very effective for those who are prone to urinary tract infections. Let's go to the next method, which is cervical cap. In general, the few we have discussed, they are just barriers which block the cervix to avoid the sperm from entering the uterus. So what is a cervical cap? A cervical cap is a reusable. That means you can use and use it again. It's a reusable prescription silicone covering that you fill with some spermicide and place over your cervix to prevent sperm entering the uterus. It's more so or less like the diaphragm, because they cover the uterus to prevent the sperm from entering the uterus. Cervical cap is a reusable prescription silicone covering that you fill with spermicide and place over your cervix to prevent sperm entering the uterus. It's 86% effective for people who have never given birth. Get it very clearly. It's 86% effective for people who have never given birth, and 71% effective for those who have given birth vaginally, because vaginal birth stretches the vagina and the cervix, which can cause the cervix cap fit poorly or not as well as it should. Let me repeat this. It's 86% effective for people who have never given birth, and 71% effective for those who have given birth vaginally, because vaginal birth stretch the vagina and the cervix, which can cause the cervical cap fit poorly or not as well as it should. So if it is not going to fit as well as it should, or if it's going to fit poorly, it may allow sperms to enter the uterus, and somebody may end up becoming pregnancy besides having a family planning method in place. I hope you get that very clearly. So it's good. It's a good method for those who don't want hormonal effects, or those who have hormonal problems, or those who are allergic to hormonal contraceptives. It's a good method for those who don't want hormonal effects of pills, implant, a shot, or a patch. Some people are sensitive to spermicide, which has to be used for this method to work. Some people are sensitive to spermicide, which has to be used for this method to work. The cap also has to be left in place for 4 hours after sexual intercourse, which some people find bothersome. Some people are sensitive to spermicide, which has to be used for this method to work. The cap also has to be left in place for 4 hours after sexual intercourse, which some people find bothersome. A point to note: it requires prescription and must be replaced every 12 months. So there is a little bit of legwork involved with getting and upkeeping them. Let me repeat this. It requires prescription and must be replaced every 12 months. So there is a little bit of legwork involved with getting and upkeeping them. This marks the end of our video today. And thank you for your time. Thank you for being with me. Thank you for supporting this channel. Let's meet in our next video tomorrow, and have a blessed day ahead.